Well, recently we've heard about the outbreak of measles in Washington State and New York. This after measles had been eliminated in the United States in 2000. And according to the Center for Disease Control, there have been cases reported in Texas, California, and Connecticut as well. Carolee McGrath sat down with registered nurse Maggie Eboso, the Infection Prevention and Control Coordinator from Mercy Medical Center, to learn more about the outbreaks and prevention.
Measles is a virus, and viruses generally are very easily contagious. And this one happens to be one of those that is extremely contagious. And then the implications of it is that people that haven't gotten the immunizations are very high risk. There's a 90%, if you didn't get the vaccine, 90% that you will get infected with it. The cold is a virus. Flu, those are viruses, so that's how people end up getting it. And the last few that we've seen prop up, we've seen one in, like you talked about, New York. There was another one at Disney, because these are places where people are outdoors. Like in Disney, there's a lot of contact with a lot of people. And if one person, like you're coughing, you have conjunctivitis, you have runny nose. Those are some of the types of signs and symptoms that people will have with measles. And you're touching things, you're touching rails, somebody else comes and touches after you coughed and touched those. That's how they are up to getting that measles virus transmitted from one person to the next one. So droplet and contact.
Okay, so I know there was also cases in Washington as well. Tell us, as far as, your research, how did this happen in the most recent case?
For the most part, they are attributing this to, like, it's imported. One person comes into the country. We've become a global society. People are traveling. One day you're here, the next day you're somewhere. And because of the globalization of the world, people are traveling and going to places, and they may not necessarily be symptomatic as they start their journey, and by the time 18 hours later they get to a destination, they now maybe have a cough or some other symptom, whatever the virus presents itself as for this person. And if they happen to be in this instance, like the Amish society where the last one was in Utah, because that population has very low vaccine rates, again, that's the high risk, and generally it's children under 5 who are at highest risk for it. They get it, then it's just going to spread. And those are the instances that we have seen so far. So at this point, anytime any person that reports measles, because it is reportable to every Department of Public Health in each state, and then obviously up to the CDC, the first thing they do is start the investigations to find out who was the first point person, who's the source, and then they want to attribute any recent travel. Have they been here? Are they natural born? Are they up to date with their immunizations? And that's how we try to find out the source and the connecting all the dots.
It had been almost eliminated, though, in the United States, correct?
Yes, it had.
So explain that.
Because the vaccination rates were so high. I'll go back up to maybe 1964. We were getting up to 500,000 cases per year with more than 100 deaths. But because we were getting people parents to vaccinate their children, those numbers dropped significantly. And by the year 2000, endemic, they said, was basically eliminated, which really translates in, we went to 12 months without a single case of measles being reported in the country. The next case where we had a significant pop-up, we would have a few sporadic cases here and there, but then the next one was around 2014, and this one was the one that was attributed to the Amish, and it was actually someone that had traveled, imported it here, and because they went into a community that had very low vaccination rates, that's how it ended up getting to all those people that got it.
Now, when babies get vaccinated, I think it's around, a year old, and there's 2 vaccinations.
There's 2 vaccinations.
Explain the vaccination process.
When they first introduced the vaccines, this was in the 1970s into the 80s. That's when we really got successful with teaching about it. It was introduced first as one vaccine. And the recommendation is that anyone from 12 months to 15 months, they would like the children to get it. And they were trying to see every time they introduce a vaccine, they're still doing more studies regarding what are the effects of it and how long is the immunity lasting in your body. And then even after you got the vaccine, when you do end up getting exposed to that virus, how is your body reacting to it? studies indicated that they needed to do a second vaccine. So later, I think in late 90s, they wanted that second vaccination. And the recommendation for that one is school-age children, basically anywhere from 4 years, when you're starting the pre-K, 4 to 6 years, the recommendation is that they should get the second one. And the reason being is that this lasts you longer into your, so even if you end up getting exposed. But because the vaccine hadn't been there that much longer, they're looking at people born prior to 1957. They're checking to see, did you ever get the disease? Do you have, they call it IgG. That's how they check to see if you, because once you get exposed to something, your body develops some immunity to it, and that's the IgG. But if you get sick now, and maybe you probably hadn't gotten a disease or hadn't got any exposure to it, we check the IgM, that's your body's reaction to it, and that's what you would have if you have an acute infection at the present time.
How sick do you get if you have measles?
It varies. It depends on how strong your immune system is. Children generally, and then the very elderly, the ones who are immunocompromised, could get really sick. And complications vary from pneumonia to significant respiratory issues and even death. But majority of the deaths attributed to measles is children under 5 years old. Here in America, and like in the Americas, the American Peninsula, like they said, it's very low. But if you look at the WHO, World Health Organization, the numbers that they point of children still dying from measles today is up to 90,000 per year. And that translates to about 246 kids every day. So like in the third world or developing countries that still aren't up to date in terms of immunization for all the children that need to get it, thus are where they're seeing very high mortality rates with children under 5 years of age.
So some parents get concerned about all the vaccinations and wondering, what's in these shots, what are the possible side effects long term. How do you kind of explain to parents or help them feel better about bringing their child in to get all of these vaccines?
The vaccines are safe. I have children too, and all my children are up to date with vaccinations. And even me today as a healthcare worker, think about the flu vaccine. I get it every year because I want to keep myself and I want to keep my patients safe. So with everything that is in the world today, there's always going to be a side effect, but vaccines in general are safe. They've done a lot of studies. They continue to do studies. It is not an end all that because they studied them and gave them and that's the end of, no, they still continue to look at it. We have people that have had reactions to all vaccines across the board, like for the flu, which I take as an example. The people that get it and get Guillain-Barré, that really is a serious condition. So those, they say, don't get it and never get it. As far as measles goes, there hasn't really been significant studies. What they're seeing is that many years after they got measles vaccine or measles, they'll end up with a condition. It's called SSRE. It's also pretty significant, but it's a very small percentage. So I wouldn't necessarily deter parents from getting it. As a healthcare person, as a nurse, as a parent, and having, my history is that I was born in Kenya, and I have family back in Kenya, and I've lived and seen, because I've only been here for a few years, I've seen the effects of people that didn't have access to healthcare, that didn't have the luxury of getting the vaccine, and the debilitating effects that they've had because they ended up with TB or polio or measles because they never got the vaccine and didn't have access to it.